Good morning, ma'am. I am Mariel Torres. So for today's video, I will tackle or explain all about the newborn care, the Leopold maneuver, the perennial care, and the urinary catheterization for male and female. So first, the newborn care. Newborn care, a nursing intervention, is defined as the management of an infant during the transition through to urine life and the ensuing pace of the stabilization in the nursing intervention clarification. So, newborn care refers to the care given to a newborn infant from the moment of birth to about a month after birth. During this 20 to 30 day period, the newborn infant is referred to a neonate. So there are some importance of the newborn care, which is there's a lot of evidences that following the suggested initial newborn care procedures lower the chances of death, especially for extremely little babies. Contacts with healthcare providers, particular those connected with antenatal care of hospitalizations for labor, provide genital opportunities to affect this behavior. So there's some indications of the newborn care, which is the general nursery or well-being nursery. This level of care is for healthy newborn who are physiologically stable and are being evaluated and observed in the postpartum period. So newborn require a lot of attentions, such as regular feedings and diaper changes. Diaper rash and the cradle cough are two health concerns that affects babies different than older children and adults. During the first year of life, your kid will go through a lot of changes. You might be apprehensive at first. If you require assistance, contact your healthcare practitioners. Next is the Leopold maneuver. There are names of the gynecologist Christian Gerhard Leopold are used to assist the location of the pregnancy inside the woman uterus. They are also used to calculate the fetal weight term. The exercises consist of 4 unique activities, each of which aids in determining the fetus positions. Only qualified medical personnel who have undergo training on how to conduct Leopold maneuvers safely should perform them. You should not attempt to complete them on your own. So there is some importance about the Leopold maneuver is to palpate the graven uterus in a methodical manner. The Leopold procedures are used. This abdominal palpation approach in inexpensive, simple to use, and non-invasive. It utilized to figure out the fetus locations, presentations, and the engagement of the womb. So there's some indications about Leopold maneuver is the palpate the graven uterus. This abdominal palpation approach in inexpensive, simple to use, and non-invasive. It utilized to figure out the fetus locations, the presentations, and the engagement in the womb. The indications and the importance are different of it. Next is the perineal care. So, perineal care is the entailed bathing the external genitalia and surrounding areas with soap and water alone, or a professional prepare peri-wash in combination. From the cleanest to the dirtiest part of the perineum, clean it. Patients that need extra care is the perineal area. So the importance of this is the skin can be examined with proper perineal care. It keeps the perineal area clean and reduces the chances of it breaking down. It also lowers the chances of getting a urinary tract infections. There's some there are some indications of the perineal care is that perineal care is usually called pericare. It means cleaning the genitals and the anal regions. Perineal care can be done in conjunction with a bath or a stand-alone operations. Pericare helps to avoid perineal skin disintegrations, irritations, burning, odor, and infections. The importance of perineal care is ensuring the client's comfort cannot be overstated. The last is the urinary catheterizations for the male and female. So for the male urinary catheterizations, as the nurse or doctor insert his Foley catheter, he will lie on his back with his legs bent at the knees and flopping slightly to the side. Before the nurse or the doctor insert the Foley catheter, the meatus or the urethral aperture or surrounding area will be cleaned with betadine. So there are some indications for the male catheter. So acute or coronary urinary retentions, which can be harm the kidney. Orthopedic procedures that limit a patient's movement. The need of accurate input and the output monitor such as the ICU, benign prostatic hyperplasia, incontinence, and the effects of the various surgical interventions involving the bladder, prostate, or the bowel are all common indications of the urinary catheterizations. Next is the urinary catheterizations for the female. So female urinary catheterizations, as the nurse or doctor inserts her Foley catheter, a female patient will lie on her back with her legs bent at the knees and flopping slightly to the side. Before the nurse or doctor insert the Foley catheter, the meatus or the urethral aperture above the vagina and the surrounding area will be cleaned with betadine. So there are some indications about the urinary catheterizations for the female are the same with the male, I think, is urine catheter are used for a variety of medications reasons, the most common of which is to drain the urinary bladder for the brief period of time. An ICU may be useful for some patients who have a upper tract degeneration due to high bladder storage pressures or the poor compliance from earlier radiation therapy, neurological illness, and etc.